Trudie Lobban. I'm the founder and trustee of Arrhythmia Alliance and AF Association. Arrhythmia Alliance is a coalition of patients, caregivers, healthcare professionals, policymakers, allied professionals, in fact, all those involved in or affected by heart rhythm disorders, and in particular, atrial fibrillation. My role for the Target project is to bring the patient voice, for the patients to be heard in research, which is vitally important. In fact, it's probably one of the most important things, because without patients, we wouldn't need this research. So we need to have a real cross-section of just what it's like for people living with a condition, and in this case, atrial fibrillation. Or so years ago, atrial fibrillation was barely recognised. It was just something that happened to your heart when you got older. You just had to live with it. And many, many people lived with it and died with it by having an AF-related stroke. It's only in more recent years that it's become much more important, much more serious, and recognised that it's not as simple as living with a heart that just pounds out of your chest, feels like a bag of worms, makes you feel anxious, for some people too scared to go out, can't even climb the stairs to their bedroom. Atrial fibrillation is a devastating, debilitating condition for many people. For some, they have no symptoms, they're blissfully unaware, except they are at high risk of an AF-related stroke. And for others, as I've said, it totally dominates their lives. So it's important that we detect AF as early as possible. And it's so easy that we can help ourselves with that. We don't always need the doctor in the first place, just by knowing our pulse. Know your pulse to know your heart rhythm, it could save your life. And then you need to see the doctor. And the doctor will be able to diagnose, and once it's been detected, we can then protect against AF-related stroke with anticoagulation therapy, because you're at such a high risk of stroke if you have atrial fibrillation. But most people don't realise that. In Arrhythmia Alliance, we often get calls saying, I went to my doctor about my racing heart, but he just talked about my brain in stroke, he wasn't listening. Well, actually, he was doing a very good job, because what happens with atrial fibrillation, where the four chambers of the heart quiver rather than beating in unison, that blood clots can form. And one of these clots can travel to the brain, causing an AF-related stroke. AF-related strokes are known to be more debilitating, more devastating, and in many cases, fatal. And yet, with simple anticoagulation therapy, they can be greatly reduced. So we've detected, we've protected, but having anticoagulation therapy alone doesn't take away the symptoms. So for those living with the symptoms and the impact it has on everyday life, it's important that anyone, but especially those that are suffering, are offered appropriate treatments to correct the irregular heart rhythm. So we need to detect, we need to protect, and we need to correct. And if we do those three things, we help to perfect the patient care pathway, restoring the patient or the person living with AF back to a normal, healthy, and as active life as possible. And I feel that research, such as the research that Target has undertaken, contributes to the detect, protect, correct, leading to the perfect. Because the more we know and understand about AF, the more we understand what it's like living with. And none of us, unless we experience something ourselves, none of us can truly say we know what it's like. So it's vitally important in all research that patients have a voice. And I feel honoured that I can represent the patients, because of the thousands and thousands of patients and families that I speak to every year, to make sure their voice is heard and shared. The doctors know how to treat, but don't necessarily know what it's like, unless they have AF themselves, to live with AF. So in any research project, and this is why I welcome the invitation from Target to be part of the research, so that we can ensure the patient's voice is heard at the beginning. Is this research needed? Is it valid? Yes. It's heard throughout, so that as the research continues, we're able to feed in, will this benefit the patient? How will this benefit the patient? And then when the research is completed, not only do we disseminate the results to healthcare professionals, we also ensure that patients are also made aware, because an informed patient is an educated patient on AF, and they can then open up conversations with their physician, whether it's their primary care or whether it's their cardiologist, and they can ask about the latest research. They can ask, am I suitable? Why have I not been offered? What about if I changed my lifestyle? Would this help? So it's important that patient voices are heard and taken notice of. It's not just a tick box exercise. It's important to have someone like myself involved in all research, so that the patient's experiences, the patient's voice is heard loud and clear, and that the research that is undertaken, and if it's proven to be of benefit, that is disseminated through organisations like Arrhythmia Alliance and AF Association, so that the patients and the doctors can make shared decisions, informed shared decisions by both parties. We've talked about treatments, but what about the detection? What about what we can do? So we hopefully may not develop AF. We all talk about digital technology and AI, but what does that mean? And how does it influence people that know nothing about a potential condition that they're living with? So we need greater awareness. We need greater information, education, so that we can offer support. And those are the 4 pillars at Arrhythmia Alliance: support, information, education, awareness. They can come in any order. And with so much AI coming to market, the digital technology, we don't want to rely on Dr. Google. We need to make sure that this accurate information is disseminated to the public and to people living with a condition. And remember, sometimes if we know about it before we develop it, we may be able to eat healthier, exercise, etc., so that we can delay or prevent certain conditions commencing. So I think it's important that, as well as all the fantastic research and inventions that are coming to the market, we take a step back and look at how can we disseminate this and make people, not just patients, but people, aware and how it may or may not benefit them. And this is something that we're looking at doing with the Target research. Research projects such as Target can help towards, in fact, greatly improve the detection and the treatment options for atrial fibrillation. We need more research, just like Target, but research isn't just something that happens and then it gets published on a medical website that you can't access. We must get it out to the public in layman terms, so that all of us can understand what is available, what we can do, and how it can improve our health for ourselves, our loved ones. And it's all about sharing, dissemination. It's not just publishing research for the sake of publishing. We need to bring about change. So we need to bring about change with health professionals who welcome and understand research, but we need to be bringing about change for those that are actually living with the condition.